Welcome to Miss Club. 5 natural ways to lower blood pressure. Hypertension, commonly known as high blood pressure, affects one third of all adults in the United States, and less than half of the people with high blood pressure have it under control. High blood pressure can cause serious health problems without showing any warning signs. When your blood pressure is too high for too long, it puts you at risk for heart disease, stroke, kidney damage, or any of other disease. The good news is lifestyle change can help you naturally lower your blood pressure. How to lower blood pressure naturally? Number 1. Regular physical activity helps improve health. It's no secret that regular physical activity helps to keep you in good health. Not only does exercise help control high blood pressure, it also helps you manage your weight, strengthen your heart, and lower your stress level. Try to aim for at least 150 minutes of exercise per week of moderate intensity physical activity, such as brisk walking. While any type of aerobic activity, walking, jogging, dancing, etc., have a positive impact on health, try to find something you enjoy doing. This will make it easier to commit to a regular routine and will motivate you to get up and moving. Number 2, eat less salt. Most people eat too much salt without realizing it. The American Heart Association estimates that the average American eats about 3,400 mg of sodium a day. However, the recommended daily intake is 2,300 mg, with an ideal limit of less than 1,500 mg per day. Especially for those with high blood pressure, a small reduction of sodium in your diet can help improve your heart health and can reduce your blood pressure if you have hypertension. To increase sodium in your diet, try these tips. Read food labels. Look for low salt or low sodium variants of food and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium naturally occurs in food. Nearly 70% of the sodium we eat comes from processed, prepackaged, and restaurant foods. Don't add salt. Just 1 teaspoon of salt contains 2,300 mg of sodium. Use salt substitutes such as spices, garlics, herbs, and other seasoning in place of some or all of the salt to add flavor to your favorite dishes. Number 3. Add more potassium to your diet to reduce high blood pressure. Not only does potassium help regulate heart rate, it can also reduce the effects of sodium in the body. Potassium helps your body to get rid of sodium and also eases tension in your blood vessel walls, both of which help to further lower blood pressure. The most effective way to increase your potassium intake is by adjusting your diet as opposed to taking supplements. Potassium-rich food includes fruit like bananas, melon, oranges, apricots, avocados, and tomatoes, milk yogurt and cream cheese, leafy green vegetables, potatoes, and sweet potatoes. Furthermore, nuts and seeds, beans are also involved in it. While incorporating these foods into your diet can improve heart health, it's important to talk with your doctor about the potassium level that's right for you. Also, if you have significant kidney disease, you should avoid consuming too much potassium because your kidneys may not be able to eliminate it. Number 4. Limit your alcohol consumption. Some research shows that drinking alcohol in moderation can benefit your health. However, too much alcohol consumed at one time can cause a sudden spike in your blood pressure. Monitoring alcohol intake is very important. Alcoholic beverages can contain significant amount of calories and sugar, which can contribute to increased body fat and weight gain, both of which are factors that can lead to higher blood pressure over time. If you do drink, the American Heart Association recommends that men limit their alcohol consumption to 2 drinks per day and women limit their alcohol intake to 1 drink per day. A drink is considered 112 oz beer, 4 oz of wine, 1.5 oz of 80 proof spirits, or 1 oz of 100 proof spirits. If you are currently taking medication to treat high blood pressure, you should be especially mindful of your alcohol intake. Besides the effect on your blood pressure, alcohol can also reduce the effectiveness of blood pressure medications. Number 5. Reduce your stress to lower your blood pressure. We all have stress in our day to day lives, a flat tire in the middle of rush hour, a looming deadline at work that can cause a temporary spike in blood pressure. In most cases, once the stressful situation is resolved, your heart rate and blood pressure returns to normal. However, chronic stress may put you at risk for a variety of long term health issues, including high blood pressure, heart disease, and stroke. Stress can also increase your blood pressure level if your coping mechanisms involve eating unhealthy food, drinking alcohol, or smoking. While it's impossible to eliminate all stressors from your life, learning to cope with them in the healthier way can make a positive impact on your health and wellness, which can in turn lower your blood pressure. Some methods to help alleviate or deals with stress include reframing your mindset. Focus on the things you can control instead of worrying about situations that are out of your hands. Many times, our anxieties stem from the what if instances that might not ever occur. Putting those thoughts into perspective and reminding yourself to stay present can help calm those worries. Avoid stress triggers. Try to avoid putting yourself in unnecessary stressful situations. For example, try leaving for work a few minutes early to beat rush hour traffic. Practice gratitude. Acknowledging all the positive in our lives often helps to shift the focus away from what we want or what we are lacking. In addition to this, outwardly expressing gratitude to others can also help reduce feelings of stress. Take time to relax and enjoy. Carve out time for things that bring you joy, whether that's eating a good meal, spending time with loved ones, or listening to an interesting podcast on your commute. Find time to incorporate small moments of enjoyment throughout the day. It's important to note that if you have prolonged hypertension, your treatment may require both healthy lifestyle changes like these, along with care and medications as prescribed by your physician. Talk to your doctor for specific advice on how to lower your blood pressure. Hope you like this video. If you like it, please share, subscribe the channel and also press the bell icon. Thank you so much.